only use it occasionally or when you have a crisis. Don't use it daily, or don't use it frequently for what you consider to have pain, because it doesn't really reduce pain. It's the leading cause of acute liver failure in the United States. Now, we have Tylenol in every convenience store, gas station, drugstore, pharmacy, and you can buy it off the shelf without any question. It is one of the most toxic drugs prescribed in America.
Maybe, but I just logged out and came back in. Now I can record it.
Are we here?
Sorry, Terry, we had a momentary technical difficulty, and that's been resolved, and so we're good to go.
Okay. I guess we had a little glitch there. Somebody got into the network. Some bugs got into the lines, and I guess they cut us off. They didn't want us to talk about Tylenol, so somebody got into the lines and cut the lines off. But anyway, let's go back to Tylenol. Tylenol doesn't work for back pain. Bottom line. Researchers in Australia gave 1,650 people with back pain either acetaminophen, which is Tylenol, or a placebo for 4 weeks, despite being a first-line treatment. Everybody grabs for it. It's a first-line treatment. And why not? You can buy it anywhere. Convenience stores, gas stations, pharmacies, drugstores, and everybody suspects it's going to work. It's not a treatment to get rid of inflammation. It is not an anti-inflammatory. It does not reduce inflammation. Pain comes from an inflammatory process. When we dig out the car from the 40 inches of snow or the 6 inches of snow, we cause inflammation in our muscles. Acetaminophen does not reduce inflammation. And you've got to keep in mind that every time you use a drug, they're toxic, and acetaminophen is the leading cause of acute liver failure in the United States. Not street drugs, not cocaine, not crack, Tylenol. And now we have liquid Tylenol, we have baby Tylenol. Just be sure you know what you're taking when you take Tylenol. It's not the answer. Okay. Surgery isn't the cure either. It isn't the cure for back pain. A review study on 1,450 people with back pain. Half had surgery to fuse the vertebrae, half had no surgery and used other treatments. After 2 years, 26% of the surgery group had returned to work versus 67% in the no surgery group. Surgery patients also saw a 41% increase in the use of opiate painkillers. The number of fusion surgeries has seen an 8-fold increase in the last 15 years. America is getting out of shape. And when Americans get out of shape, they're not fit to do heavy lifting or heavy snow shoveling or any heavy straining. You can't go and help your neighbors dig your car out of the mud or the snow. You can't help your neighbors move when they're moving from their apartment to the brand new house when you've been sitting on the couch doing nothing and your tummy will hit the wall before you do. Then you know that you're out of shape. And that only causes more back pain and may lay you up and miss work or whatever you're doing for several days. And Tylenol is not the answer. Surgery is not the answer. So what do we do? How do we relieve back pain naturally? Heal your back. First of all, the best thing to do, lose weight. Get in shape. Exercise is so important, and I don't mean you have to run marathons. I think you need to do some weight lifting work. Weight-bearing exercise is the best way to lose weight and maintain muscle strength and muscle gain. When you lose weight by running or some other exercise that doesn't use weight-bearing exercises, half the weight you lose is muscle. So you get weaker. The best thing to do is use some form of weight-bearing exercises, dumbbells, kettlebells, or a weight-trained exercise, some kind that's going to make your body stronger, and in the process, lose weight, because you can also do it in a circuit, which gives you more cardio so that you lose some weight. But you want to stop pain, you want to reduce inflammation, you want to increase endorphins, you want to rebuild the cartilage in the joints and the vertebrae. Curcumin. This is my all-time favorite herb, spice. And there's a big difference between curcumin and turmeric. A lot of people today I know are reaching for turmeric because even Dr. Oz is confused. Dr. Oz gets on the air and says, oh, we'll use a little turmeric or curcumin, sprinkle it on your oatmeal. Well, that's like trying to spit in the ocean to raise the level of the ocean. Turmeric is just the spice. It's the rhizome or the root of the plant. And in that plant, you have about 2 to 4% curcumin. And that is not enough to be used as a medicine. Curcumin can be used as a medicine, botanical medicine par excellence. Turmeric is a spice. It makes food taste great. Yes, it gives you some benefits of curcumin, but in today's botanical medicine research, curcumin is the active key substance of turmeric. When you take turmeric, you're getting a very, very small level of curcumin. If you take 500 milligrams of a very super enhanced curcumin, that'll equal 500 capsules of turmeric. And curcumin acts on multiple inflammatory pathways at multiple levels of those pathways, all simultaneously, to neutralize free radicals. So it's a very powerful anti-inflammatory, very powerful antioxidant, which is the root cause of all pain. And then Boswellia, an Indian herb or an Indian tree known as frankincense, one of the major gifts given to the birth of Christ by the 3 wise men. Frankincense, Boswellia, very, very powerful anti-inflammatory. It is not, does not have quite the range of benefits that curcumin has. Curcumin, anti-inflammatory, antioxidant, immune neutralizer. It actually boosts the immune system without overstimulating it. So it actually harmonizes it. So it doesn't overstimulate it. If it's overactive, it breaks it down. If it's underactive, it'll bring it up. So it's beneficial for immune function. Liver function. It has a lot of benefits. Boswellia is a very powerful anti-inflammatory. It is not a very powerful antioxidant. But it has a very specific action on the 5-lux enzyme. It's an inhibitor of the 5-lux enzyme. And right now, today, currently, there is no drug on the market that affects the 5-lux enzyme. So it reduces inflammation, also relieves pain. So a combination that has been studied at Baylor University, which has put together curcumin and Boswellia, has actually been more powerful than just curcumin by itself. Now, if you add on white willow, and white willow is the starting material for aspirin, salicylic acid, relieves back pain and reduces inflammation. Then when you tack on DLPA, which increases endorphins in the brain, they're the natural pain-relieving compounds found in the brain. It's the feel-good hormones. And DLPA, which causes more of a flood of endorphins and retains those endorphins for a longer period of time. So as we get older, you know, the aging process takes a lot away from us. And if we want to maintain our health, then many of these compounds like curcumin, Boswellia, white willow, DLPA, all of these help the aging process as well, because as we age, we lose the ability to maintain some of these very important enzymes in our body, including endorphins. We lose the ability to secrete endorphins as we get older. And devil's claw increases the production of hyaluronic acid, which is a lubricating fluid in the spine and all joints. In fact, devil's claw is the #1 herb sold in Europe for arthritis. Now, a combination, curcumin, Boswellia, white willow, and devil's claw, wow, what an impact of nutrients to support the back muscles and all muscles in the body. Okay. Curcumin stops pain. Up to 70% reduction in pain sensitivity from an animal model of arthritis. And in several other studies with osteoarthritis, rheumatoid arthritis, curcumin and Boswellia has been as effective as medications, prescription medications, even to the point of matching the benefits of Celebrex and even outperforming Celebrex in some of the markers. 59% reduction in pain as measured by a standard pain scale versus 49% decrease in the drug treatment group in patients with rheumatoid arthritis. Curcumin, I've talked to scientists from both MD Anderson Hospital and Baylor University, and both have said they have never seen a substance like Curcumin or Curcumin, which is more powerful than any drug they've tested in the laboratory. One of the most powerful substances, anti-inflammatory, better than steroids, and no side effects. And we know there's many side effects from these drugs, including steroids. So curcumin for the back. Cells from human discs, the shock absorbers in the spine. They're like a stack of poker chips. We're exposed to inflammatory compounds for 2 hours and then treated with curcumin. Result, up to 80% reduction in expression of different inflammatory compounds. 70% reduction in the activity of enzymes associated with cartilage damage. Boswellia, the 5-lux inhibitor. Now, when I say inhibitor, that doesn't mean it stops that enzyme from working. It reduces the overexpression of that enzyme. 5-lux is a pathway or an enzyme in the body that regulates a compound called leukotrienes. When we have an elevated level of leukotrienes, we have more pain. But we also have more upper respiratory tract conditions and also intestinal tract conditions. But pain is one of the more specific conditions caused by an overexpressed, over-elevated 5-lux enzyme. So what it does, it downgrades it. It doesn't inhibit it. It doesn't poison it. It doesn't block it out because drugs actually do that. Vioxx, what they thought would be the end of pain. That drug was going to stop pain and would stop arthritis. And it did, because it stopped the COX-2 enzyme entirely, and then people started dying because then they had blood clots, heart attacks, and strokes. The COX-2 enzyme, the 5-lux enzyme, we can't live without. But we can't live with them when they're over-elevated or overexpressed. So nature takes them down to a level where they are in harmony with one another. The 5-lux is the primary enzyme responsible for the production of inflammatory compounds called leukotrienes. The 5-lux activity is associated with inflammatory conditions such as arthritis, lung diseases, asthma, COPD, bronchitis, sinusitis, all of these upper respiratory tract, and as well as Crohn's disease and colitis. These are very, very powerful natural medicines. They're as powerful as drugs if the quality of the ingredients are matching scientific studies and at the dosages of those studies. You can't just buy Boswellia and curcumin if they're not well quality products and if you're not using them at the dosage levels that's required to match the scientific studies. They have to be matching the studies to be of benefit. Boswellia reduces pain. Increase of 12% in pain tolerance 2 hours after Boswellia use in healthy human volunteers. Test measured tolerance of pressure on the nail band. Okay. Now, curcumin and Boswellia together, studied at Baylor University for a variety of conditions, even in the form of cancer. Stops arthritis pain. Stops arthritis pain as effectively as Celebrex, a prescription drug. Everybody knows Celebrex. If you watch TV any evening of the night, you're going to see more than likely an ad for Celebrex. Celebrex is the #1 prescribed medication, and it needs a prescription because it's toxic, it has side effects. Celebrex is the #1 drug prescribed for arthritis. In a study, a combination of curcumin and Boswellia had better reductions in pain and greater increases in walking distance than Celebrex. At the end of the study, 92% of the group that took the herbs, combination of curcumin and boswellia, could walk a distance further than the group that took the drug. So 92% in the study of the herbs, the two herbs, could walk a distance further than 85% in the drug group. So it outperformed the drug group, but you know what really makes it better in performance is you're getting as good a result, and in fact better results than the Celebrex group, but no side effects. In the Celebrex group, patients stopped taking the drug because they had adverse events. There were side effects. In the group taking the curcumin and the boswellia, they had no side effects. No adverse events at all in the herb group. So you know when you take it for your pain, you don't have to be worried about it. You don't have to be concerned that there's going to be side effects. And in many of these drugs that have side effects, then they give you another drug to treat the side effects of the first drug. Now, in the group taking Celebrex, adverse events included headache, abdominal pain, indigestion, diarrhea, nausea, bloating, gas, dizziness, nervousness, headache, runny or stuffy nose, sore throat, rash, insomnia, and serious stomach and intestinal ulcers. My gosh, why would anybody want to take Celebrex when you know you could take a good, high-quality, super enhanced curcumin with boswellia? It just doesn't, maybe I'm very biased, but I just don't see why anybody would want to take a drug when you could really try first. And I think most alternative physicians, the first line of defense is to try an herbal or natural alternative. And then look, if the results aren't good enough, you can always resort to the drug. But why not try the natural approach before we try something that causes so many of these side effects? All these side effects are commonly treated by other drugs. Okay. White willow, more effective than drugs for relieving back pain. As effective at relieving back pain as prescription NSAIDs, like Vioxx. I had mentioned that earlier, because Vioxx poisons the COX-2 enzyme. It stops it from working. We can't live without that enzyme. That's why there was heart attacks, strokes, and something like 37,000 deaths. Now, they had to take, the FDA, you can't ignore that many deaths. So they had to take it off the market. Vioxx is long gone. It worked fantastically. But drugs sometimes are so toxic that while they work, they cause so many adverse events that patients die. Many cancer drugs that treat cancer, the patient dies from the drug before they die from the cancer. 60% of patients in each group, white willow or Vioxx, saw significant reductions in pain. But white willow, like we know about nature, is less expensive and has significantly fewer side effects or adverse events. In a study of white willow versus other conventional drugs or treatments, 40% of the white willow group was pain-free in 4 weeks, while only 18% of the conventional treatment group was pain-free. Nature is so much more in tune with what the body is doing. And drugs, all drugs are foreign to our body. Drugs have never been on the face of this earth until somebody made them in a laboratory. White willow, curcumin, boswellia, these are all natural compounds. 191 patients received low or high dose white willow extract or placebo. For back pain, 60% of the patients getting white willow were pain-free in a month, while just 6% of the placebo group became pain-free. Pain reduction for the white willow group was noticed in the first week. Okay. Devil's claw rebuilds cartilage. It rebuilds cushioning cartilage between the joints, as well as does curcumin. But 38% increases in the glycosaminoglycans which are natural building blocks of tissue that acts as a shock absorber between the joints. 41% in the chondrocytes, cells that maintain cushioning or cartilage in the joints, helps to rebuild and repair the damage to joints. So start early when you have pain with the natural compounds, which are not only pain relieving, anti-inflammatory, but rebuilding. Okay. Devil's Claw stops low back pain. 88 patients with low back pain received Devil's Claw or a prescription drug, Vioxx again, which was the most powerful drug available at the time. 30% more patients in the Devil's Claw group reported greater than 50% reduction in pain versus the drug group. 118 patients with low back pain received Devil's Claw or placebo. Placebo, you know, is a fake pill, a dummy pill. And the studies always want to show where you have a significant more effect from the product tested, like Devil's Claw, against placebo. If they're exactly the same, well, then you might as well take the placebo. But in this case, the number of patients pain-free after 4 weeks, 9 of the 51 in the Devil's Claw group, and only 1 out of 54 patients in the placebo group. Very, very significant. 130 patients with low back pain received Devil's Claw for 8 weeks, had significant pain reduction and saw improvements in spinal mobility. Okay. DLPA. This is an amino acid. It actually relieves pain and improves mood. It relieves pain and eases depression. Symptoms of depression are likely or linked to poor recovery from low back pain, or linked, I should say. And many of these times when people have pain, they become depressed because they're in pain. I don't think they really have what I would call chemical depression. They're depressed. Sometimes we just get depressed for certain reasons. I don't think we have clinical depression. But when pain is constantly plaguing someone, why not? It's easy to get depressed over that. And DLPA relieves depression. In a clinical study, 70 patients with herniated discs also suffered from a mood or anxiety disorder. DLPA increases mood elevating compounds in the brain, including serotonin and dopamine. DLPA prevents the breakdown of the brain's natural pain-killing compounds. Okay. Exercise. Here is where we fail. America fails. And most Americans do the wrong type of exercise or excessive exercise. The best exercise you could do should not take you more than 6 minutes a day. But that's another subject. Maybe another time when we can do a presentation on what exercise to do to be in the best physical shape. It doesn't take you getting out of your house, buying a membership, traveling across town. You can do everything you need to do at home. Exercise strengthens the muscles that support your spine. Your spine is like a stack of poker chips, and that stack of poker chips is going to tip over if you don't keep it strengthened by the muscles and the lattice work of your ligaments and tendons. And what happens when we have this big tummy, it pulls against that stack of poker chips, and it pulls it out of shape. A recent study found up to 45% improvement in a reduction in pain and an increase in quality of life after 8 weeks of exercises to strengthen back muscles. A study of specific isometric exercises 3 times a week for 6 weeks in young men with back pain found up to a 60% reduction in pain. We need to take our health as our own responsibility. All these things taken in natural compounds for reducing pain and inflammation. No side effects. We just saw that in the previous part of the presentation. You can use natural compounds to relieve inflammation and pain. We can strengthen our body by exercise. Found up to 60% reduction in pain in just 6 weeks. 3 times a week for 6 weeks. We have a reduction of pain. We don't need drugs. Drugs are not the answer. Drugs are always going to make us weaker, and it's going to have a greater toll on our body because it's going to cause more side effects. I'm not against drugs. I think drugs are a part of a good, healthy lifestyle when they're needed. If we're in an accident, don't go to some health food store and get me some vitamin C and some fiber. I want a drug if I'm in pain and I'm dying. I need more than vitamins and minerals. But all these natural compounds keep us healthy and keep us in good shape. And in a crisis, in an emergency, then we need a drug. But today, drugs are dispensed for every condition that we should be using a natural lifestyle choices to correct. The best diet, the best form of exercises, the best natural medicines. We can stay in top shape without drugs. We consume more drugs in America than any other country in the world, and we are the sickest country in the world. So always check with your healthcare practitioner or professional before doing any exercise for back pain. Be sure you always know that you're in shape enough to do some form of exercise. Okay. What to know about back pain? Muscle. Most metabolically active tissue. Changes can be seen within a few days. And in bone, good blood supply, but slower to change than muscles. Requires several weeks for strengthening and repair. And ligaments and tendons don't recover very quickly, so we need time. Time is a big element. T-I-M-E. Time. Don't be so impatient. We did not get in the condition we are in a week. If we're unhealthy, we have back pain, we're out of shape, we are 60, 70, 80 pounds overweight, that did not come over weeks. That came over diligent work to get out of shape. And that takes time. So it takes time to reverse and to get back in good shape. Because ligaments and tendons have very poor blood supply. Healing from injury can take months. Tendonitis, bursitis, all take time to heal. And for the disc, no blood supply and low cell density. Area around the disc can heal, but process takes months. Don't stop playing tennis because you have pain, and then after a few weeks you feel better. You still have not recovered. You give yourself time, and using the right nutritional support and the right exercises, get a good trainer. If you need to have someone help you, get a good trainer to put you back in shape. Recovering from a back injury can be a long, slow process, but better than drugs, better than surgery, because surgery, usually one surgery begets another surgery, and that begets another surgery, and then after the third surgery, oh, sorry, we can't do anything more for you. Okay. The protocol for back pain. Well, first of all, get a good combination of DLPA, curcumin, Boswellia, white willow bark, and devil's claw. Support all of your health with these elements and exercise to build core muscles. Talk to a healthcare provider first to see if you should exercise and how much exercise you should take on. And then maybe if you don't know what to do, Google some things and find out. I like kettlebells, even just doing the kettlebell swing several times a week, finding some good weight-bearing exercise. If you are unsure, it doesn't cost you much to get a trainer for a few weeks to at least put you in the right direction to do the right exercises the right way. Because if you don't exercise right, exercise can be harmful too. Be patient and allow time for proper healing. And that, you can recover from almost anything that plagues you now. Be patient. Okay. Oh, questions. Okay, we're back to questions, Cheryl.
Thanks so much, Terry. I really appreciated that information, and we already have a lot of questions in our Q&A queue, so let's get started. First is, can these products, especially curcumin, be used for sports injuries in children? How would one determine the dosage for a child over 8 years of age?
Well, that's hard to give you a dosage range because these are all different combinations of DLPA and Boswellia and curcumin. But if you can find a capsule that would contain some of these ingredients, I think for a child over the age of 6 to 12, maybe like a 1 capsule dosage, or maybe from 12 to 18, a 2 capsule dosage. And yes, for sports injuries, but if your child is complaining about pain, you don't want to give your child something for pain unless you know exactly why your child is complaining of pain. If a child is complaining of pain, because usually they should not have pain, not at that age, you need to see a physician. But if you're out at a soccer match and you see your child sprain a knee or sprain an ankle or something, absolutely, some of these ingredients like curcumin and Boswellia can have a huge advantage to help them heal that injury, but always keep in touch with your physician as well.
Excellent. There's another question here about medical conditions. Is there any medical condition that you should not take curcumin?
I'm going to quote Dr. Ajay Goyal. Dr. Ajay Goyal is the chairman of the Gastrointestinal Cancer Research Center at Baylor. He's an expert in the world on curcumin. He has studied curcumin for over 20 years. He said there is no condition that curcumin could not make better. He said, I would use that in every condition that man or woman would complain about, and he said, will have a major effect.
Excellent. We also have a question about the time frame used in the Devil's Claw study. I believe that was 6 weeks, correct, Terry?
Yes, that was correct.
Where can I learn about a 6-minute exercise program?
Well, if you Google 6-minute exercise kettlebells, you'll come up with a number of them. Or otherwise, just Google kettlebell swing. Kettlebells are a iron ball, looks like a cannonball, but it has a handle on it. And you do a swing. And if you Google that kettlebell swing, you'll see YouTubes and you'll see videos on how to do it correctly. And if you do that for 1 minute, you do the kettlebell swing for 1 minute, and then you pause for 2 minutes to rest, and you do that 5 or 6 times. So really your exercise, your time span is 15 to 18 minutes, but you're only doing the 1 minute exercise 5 or 6 times, so it's only 5 or 6 minutes of pure exercise, and that can strengthen 400 muscles in the body. If you just did that I would say every other day, you'd be amazingly in good shape and good health. Combine that with a good healthy diet and good supplements, and you can get back your health in a matter of months.
We also have some questions on Devil's Claw. We have a question that, is it true that Devil's Claw can really rebuild cartilage?
Yes, absolutely. Absolutely. It could actually increase the hyaluronic acid up to 50% in the joints, and helps to rebuild the cushioning and the collagen in the area, and also the cushioning area in the joint area. If you have enough there to rebuild on, if you're bone on bone, no, you don't have anything to build with. But if there's enough there, you can rebuild.
By magic out of nowhere, you have to have some starting to help improve.
Yep, you have to have the tools there to start.
Okay. Are these products safe to use during pregnancy?
I would always check with your physician. We don't know the complications of pregnancy. We don't know enough studies. We don't have any studies, I should say, nowhere in the world on curcumin or Boswellia on pregnancy. So I would always check with your physician.
Excellent. Great advice. Let's see. Folks, there's a couple of you that have asked for specific product names. There's something to recommend that would contain all these ingredients. Because we try to keep these educational webinars, we try to not make them infomercials. We want them to be about the science behind ingredients. But if you are interested in specific product recommendations, we'll share that with you later or direct you to some websites. Here's another question having to do with dogs with back pain and disc problems. Can you use these products in dogs?
Absolutely. Dogs respond very, very nicely for hip dysplasia or for joint pain or any kind of pain. They respond very, very nicely. Depending on the size of the dog, you could probably, if you could find this combination of capsules, anywhere from a half a capsule to 1 or 2 capsules, depending on the size of the dog. Yes, they respond very, very nicely to the use of Boswellia and curcumin and even all the combinations, white willow bark. There's nothing that would be indicated for a dog.
A question about curcumin specifically. Can you take curcumin daily for maintenance like you take your multivitamins?
Well, I take curcumin every day. I will take it every day for the rest of my life. Curcumin reduces inflammation. And inflammation is the cause of all of our diseases: obesity, type 2 diabetes, cardiovascular disease, Alzheimer's disease, type 2 diabetes. You could name all the conditions that we struggle with in America today, and curcumin can have an effect on every one of those conditions. I will never give up curcumin. I take it daily. I've talked to the top experts in the world at Baylor and MD, and they take it daily. And they even go on to say that, and these are top researchers, they say it's one of the most miraculous compounds that they've ever tested in the laboratory. I would not be without.
Here's a question about chemotherapy. Are there any chemotherapy medications that you can't use with curcumin, that they would interact negatively?
Well, I'm going to say this from a scientific standpoint, and then also I'm going to give you some cautionary measures. Dr. Ajay Goyal at Baylor did research with curcumin along with a very, very toxic drug called 5-FU. 5-FU is a toxic drug that has to be monitored very carefully because many people could die from the prescription drug before they die from cancer. But the drug is recommended in some cases of cancer. They did a study with curcumin against 5-FU or with 5-FU and found that it made 5-FU less toxic, it caused less liver damage, and they could get by with a smaller dosage of the drug as long as it was combined with curcumin. They also did a combination, curcumin and Boswellia, with 5-FU and found the same kind of results. But I'm going to caution you because this presentation reaches a lot of people that we don't know. And if you have cancer, if you're dealing with chemotherapy, please talk to your doctor. Ask your doctor. And if your doctor is not sure, I know Dr. Ajay Goyal is so open with his research that he would be happy to send his research and the studies that he has conducted at Baylor, and some of the studies that he knows some of his colleagues have conducted, and he would send them to the doctor of your choice. But I caution you that while this is all scientific studies, we don't know who you are, and we want you to make sure. We want to make sure that we don't know what drug you're taking. Talk to your doctor. Always keep, if you're going to do something different, always talk to your doctor before you make those decisions.
Good advice. We have a lot of compliments, Terry, about how inspirational you are, and somebody said they're going to be doing their kettlebell swing today. So thank you, folks, for your kind words about our webinar. I'm just scrolling through to make sure I didn't miss any questions. I want to make sure that we've given everyone a chance. Oh, here's a question. I have a C7 herniated disc and nerve sensation. I have pain and sensations down my right arm. Will what you're talking about help me?
Well, I can't tell you how much it's going to help you. You trial and error. The best thing to do is find a combination that we talked about, look for those ingredients in your health food store or someplace, and then take that kind of formulation and give yourself, I would say, 30 to 60 days. And I have observed people just amazing results, but I can't, there's no way that I can tell you or assure you that you are going to get that kind of benefits.
Mm-hmm. One would think that as the inflammation resolves, that herniated disc will slip more back into the place where it's supposed to be and would relieve the pressure on the nerve that's causing the arm sensation. So it would seem like that would be a really good choice to try.
I agree 100%, but everybody is different, but you got to give it 30 to 60 days.
Okay. All right, let's see. Scrolling through, see if I missed any, because they're coming in both the chat box and the Q&A box. That's how popular you are, Terry. There, I'm getting questions from all different quarters. All right. Let's see. Okay, I think we got everyone's questions answered.
Okay.
So thank you so much, Terry, for spending this time with us today, and thank you, everybody in our listening audience, for your devotion to learning more about how to address back pain naturally, how to get relief without the toxicities and the risks of drugs and surgery. Thanks again, Terry. For those of you who are interested in more information, please visit our website at Terry Talks Nutrition. You can sign up for a free weekly newsletter full of health tips and interesting new natural medicines from Terry. Lemerond, we are very, very scrupulous with your email address. We don't sell it to anyone else, so you won't be getting spammed if you sign up for our newsletter. You can also listen to recordings of past seminars on that website, and you can ask Terry your own personal questions in the Ask Terry section of Terry Talks Nutrition. Please visit YouTube. We have a new Terry Talks Nutrition channel on YouTube where we are also archiving our webinars and other video information about the healthy use of natural medicine. So thanks, everyone. We have 2 events coming up in the very near future. On February 4th, we have Dr. Holly Lucille. Her presentation is Not Your Mama's Turmeric, Unexpected Uses for This Mighty Herb. And, well, we're going to have Terry back to talk about exercise. And we had so many questions on exercise, Terry. So I think that this is a perfect segue into this one. So skip the marathon, short burst exercise is best, and that's on February 15th at 11 a.m. Central Time. So thank you again, everybody, for taking time to listen to our presentation today on interventions for low back pain. And if you have any questions, as I said, feel free to contact us via the Terry Talks Nutrition website, and we'll do our best to get you an answer. So until we meet again, thanks, everybody, and good health to you. Bye-bye.